things physically are not in place, so to speak,
Yeah.
where there are several different chiropractic techniques. There are several different, I guess, chiropractic approaches to assessment to fulfill that part of in the birthing process.
Behind the practice.
Welcome to Behind the Practice. I'm Katie Brinkley, and today I'm joined by Dr. Mikhail Atkins. Thank you so much for joining me on the podcast today.
Thank you for having me.
I'm really excited for this conversation because, well, chiropractic care changed my life. I was told that, well, this is just the way you're going to live. And I was devastated. I have 2 young daughters. I was told that I had undiagnosed scoliosis, and this was just my life for the rest of living, and I was 35 years old. All that changed, though, once I found a chiropractor that worked for me. So, Dr. Atkins, I'm so excited for our conversation because I know a lot of people maybe are still a little hesitant about chiropractic care.
Okay. Yeah. I mean, they better get ready. It's not going nowhere. Yes, I'm a chiropractor. Studied in Buffalo, New York, at DeUval University. A lot of people don't know about that school, but they are focused on a lot of medical practices, which helps transition chiropractors that come from that school to work with other professionals.
Yeah.
So I've been very blessed with the background that I have. I've been an apprentice in mentorship for almost 20 years. So even before going to chiropractic school, I was able to just be in the throes of things
Yeah.
and get the experience I needed. So once I got to school, everything was a breeze.
What really drove you into chiropractic care?
It was being an athlete in school. I played basketball and ran track in college.
What was your event in college?
I sprinted. I think it was the 55
Okay,
at the
okay.
time. Couldn't do a 400. My lungs ain't that strong. But yeah, I had a couple injuries, and my trainer at the time, I was traveling 2 hours back and forth to my trainer to school to just feel better. And he introduced me to his chiropractor, Dr. William Briley in Lockport, New York, who has worked with the Bills, the Sabres, and has a wealth of knowledge. He also practices functional medicine and dabbles in active release therapy. So he introduced me to chiropractic and then a world of health that I knew nothing about.
Why do you think that chiropractic care is still maybe not looked at as the first option in so many medical, treatments?
Everything boils down to 2 things, in my opinion: knowledge and acceptance. You know what you know until you don't, type of thing.
Yeah.
And at that point, when you are introduced and exposed, you got to make a choice. Are you going to accept it or not?
Yeah.
Chiropractic has been the stepchild to medicine for as long as I've learned about it.
Yeah.
And it has a pretty grueling history of just trying to fight for its space within the field. I am a proponent of medicine, period. Patient-centered. The patients come first. We cannot allow that type of division to stop us from doing us right by the people who need us.
Yeah.
So yeah, it's been a fight for the field for a long time, and I'm more than happy, a frontline soldier, to be a part of that fight for competence and the right to practice.
Yeah. So let's talk a little bit more about what type of chiropractic care you offer, because there's, as the industry evolves,
Yeah.
there's a number of different ways of receiving chiropractic care. So what type of chiropractic care do you offer?
So just by credentials, just general chiropractic care. Through experience, though, I have had the opportunity to work under Georgia's #1 pediatric chiropractor, Dr. LaKendra Fulbright, out of Decatur.
Yeah.
She actually brought me to Atlanta, and I worked with her as a student intern, and she brought me on board, and that changed a lot for me. So working with babies, pregnant
And
moms.
people might be saying, wait a second, babies for chiropractic care? Let's talk
Yeah,
about that.
yeah. Well, I'll ask you this: do you think the birthing process is a traumatic event?
I have two children, so yes, the birthing
She said
process.
yes. She said
Yes.
yes. She didn't hesitate. Yeah. No. Yeah. It's traumatic. And things, protocols have changed to allow that process to be a lot more smooth. But still, let's put ourselves in the shoes of the baby coming out into this new world. You have to get slapped up and dapped up in order just to breathe. So things physically are not in place, so to speak,
Yeah.
where there are several different chiropractic techniques. There are several different, I guess, chiropractic approaches to assessment to fulfill that part of things in the birthing process.
Yeah.
You don't have to go to a PCP necessarily. You can find a chiropractor who is certified to do these testing, and bring your baby to them first day out.
Yeah.
You can have a chiropractor partner with either your hospital, your doulas, your midwives, to go through the process with you of doing a technique, just a Logan technique, a Webster technique, something to help you through the process. And then once the baby comes out, start assessing baby for the right reflexes, start assessing the joints, start assessing, making sure the right processes inside are actually happening internally.
So, and you also mentioned pregnant women.
Yeah.
I'm sure that a lot of women might be saying, "Wait a second, I didn't think I could even get my feet rubbed," and you're saying that I can see a chiropractor?
Yeah. So we're talking low force techniques now. So a lot of people are thinking about the back cracking and neck snapping. Um, and we like to refer to it as adjusting, just so everybody is clear. But there are lower force techniques that we can use to help the body that is going through these constant changes. Ligaments are getting soft, joints are easier to move. You're having this up and down relationship with your blood pressure, with your muscles. And moms go through periods of pain during pregnancy. And I will say there are some mothers who carry it a lot better. But even adjusting to something like that, by the time they are post-pregnancy, something may not be going as smoothly as it was physically before pregnancy.
Yeah.
So this is a time you want to take to talk to your chiropractor, at least go through an assessment, see if you might have irritated your SI joints, irritated your lower back, put a strain on your neck from going through the process. It's just a part of, at this point for me, it's a part of the routine post-pregnancy.
Yeah.
Yeah.
So, let's talk about your practice. Who do you specialize in seeing and treating?
Right now, I'm specializing with working with PI patients, personal injury patients.
Yeah.
I have a mobile chiropractic practice.
Oh.
I also work in several offices. This mobile practice is solely mine. So I'm taking my time in introducing it to the world because Atlanta, as some people may know, is riddled with chiropractors. You'll find one on every corner. It's almost like your Publix, your regular Publix. So I would like to do this in a different way that brings a nuance, small nuance of interaction to a patient.
Yeah.
Right? I need to know your name. I need you to see me as a person who's capable and who's able to see you outside of your pain, see the vision with you, because you're coming to me because you want to be out of it.
Yeah.
So as we're treating, I want to be able to be on that journey with you. And the mobile part of it, right, I'm coming to you in your workspace, coming to you in your home. It brings that aspect to it.
Yeah.
And it takes away the white coat syndrome, so to speak.
Yeah.
And I'm seeing just that interaction helps increase outcomes tremendously.
Well, I'm sure too, if there's anybody that owns a corporate office or maybe even a co-working space, bringing someone like you in or having the opportunity to bring in someone like you that has the mobile practice is probably pretty rare, especially it's the first I've ever heard of that kind of opportunity.
Yeah, there's a few, but I think at some point what gets in the way is profit, so to speak.
Yeah.
So, the doctors or the professionals that are doing that service tend to start to navigate that part of things. Their practice will bend to that part of things.
Yeah.
I'm not there yet, and I'm keeping the focus to not get to that part, trusting in my faith in God that, what I'm doing it the right way.
Yeah.
And the residuals financially and socially from the public will come with that.
Yeah.
Yeah.
So 5 years from now, how would you like to see chiropractic care viewed within the medical industry?
So with my education, we had a heavy dose of interprofessional workspaces. So I was working with surgeons, I was working with neuros, working with PTs, working with nurses, you name it. And actually, one of our placements was in one of the busiest triage centers in ECMC in Buffalo. So at this point, 5 years from now, I'm hoping to see chiropractic inside of these medical facilities.
Yeah.
I'm hoping to see chiropractic side by side with your neuro or with your PT when you are coming back from surgery. I'm hoping other doctors can understand that on a nervous level, we have impact. We have impact to healing. We have impact to allowing your patients, just from a day-to-day standpoint, when they don't see you, actually feel something.
Yeah.
Feel like they're getting better and not just hearing it.
Oh, yeah.
Right?
I love that.
So it's face value. We have something that most professionals in the medical field don't have, because we put our hands on you guys as patients, and we're able to impact you guys right away as patients without doing anything invasive, without having you feel like you are overly exposed. If you have the right chiropractor in front of you, they can give you that immediate relief and not have you exceed any of those boundaries you may have with medical professionals.
So if people are listening right now and they're wanting to learn more about you, maybe they're in the Atlanta area, they'd love to have you come on into their office, they'd like to see you as their chiropractor, what's the best way for someone to get in touch with you?
You guys can get in touch with me. First, my company's name is ChiroGo, LLC. I'm based in Atlanta, but I provide services all over Georgia. You can reach me at info@chirogo.solutions. You can also see my website at chirogo.solutions. And, Precision Health and Wellness in Suwanee, Georgia.
All right.
I do some services there, and it is a medical spa. They do focus on longevity health too, so they got a lot of stuff that we're seeing here at the event. You guys reach out.
Amazing. Well, this has been such a great conversation. Thank you so much for joining me on today's episode of Behind the Practice.
Behind the Practice is produced by Next Step Social and Podcasting and hosted by Katie Brinkley and Sean Quintero. A special thank you to our guests today. This episode was recorded live at the Boston BioLife Functional Longevity Summit. A special thank you to the team that helped make this podcast happen.